Good afternoon, my name's Anne Connolly. I'm a GP in Bradford and I work in the hospital in the Women's Health Department. And today's short session is going to be about increasing the uptake of cervical screening, and the reason we're doing it today is because this week is Cervical Screening Week. Now, in the UK, cervical cancer is still the commonest cause of cancer in women who are aged under 35. The reason we do cervical screening is to try and pick up early changes to the cervix that might in the future progress to something more serious. It is a simple test. It takes 3 minutes to do at your GP, or if you want to, you can attend the local sexual health clinic to have this done. It is, as I say, a simple test, and the majority of the results are fine. But occasionally there are some findings which need a bigger check, a better check in the hospital with something called a colposcope. And what this does is then assess whether the issues with the cervix are okay and will improve themselves, or whether or not you might in the future develop something more serious, and therefore you can get a treatment at an early stage. The problem is that we know in Bradford that 1 in 3 women are still not attending to have their smear test, even though there are options of where you can get it done and the fact that this is a simple test to do. So, this week, this is Cervical Cancer Screening Week, and Joe's Trust are doing some important information to try and promote the uptake of screening. If you go onto the website, and we'll put this onto the information below this webinar, if you go onto this website, you can get lots of information about what the procedure involves, what the test means, what they're looking for, how you'll get your result, who can do the tests, and what would happen if you did go to the hospital. So this is a really useful website to have a look at. So, why is it that people don't get their tests done? There are many myths there. There are some concerns that women have about the test. Sometimes women think that it's going to hurt. But what you have to remember is the majority of these tests are done by nurses, and our nurses are well trained. They go on regular updates to make sure they understand what they're doing. They're doing lots of tests, and actually, as they're all women, they will be having these tests done to themselves. So they will understand what it is about a woman's concerns and how it is best to make this easier for her. Sometimes women think that it's too embarrassing to have done. But of course, again, this is something that's important. It takes 3 minutes, and the nurse will make you as comfortable as you can. She will explain to you what the procedure will involve, and it is done very quickly. Some women will say they don't want to know, and other women will think, well, this isn't for them. What we know is that the majority of women who have problems with their cervixes will have no symptoms at all, so they wouldn't know unless they'd been for their smear test that they needed treatment. Some women, however, do have problems. They will have some irregular bleeding or some discharge, and if you have either of those, then it's important to go and see your GP to have some checks to make sure that you don't have any problems. We also know that we women have busy lives, and the appointment comes through the post, and we put it on the to-do list and don't get around to actually making the appointment. And then when we do make the appointment, or we think we should make the appointment, we might be embarrassed and think we're going to be told off because we're late, or that by that point something might have happened, and then how would we deal with the problem? So today, this is a call for action. This is a call to make you make your appointment, to make you think about whether or not your smear test is due. Smear tests should be done on women who are aged between 25 and 50 every 3 years. After 50, between 50 and 65, you will be called routinely every 5 years. If you're not sure if you've had your letter, or you can't remember if your smear test is overdue, you can ring your GP surgery and ask them, because they will have a record of when the smear would have been due. So, if you want any more information, as I've said, about what a smear test is, what it involves, then you can look on the Joe's Trust website, or you can go onto the National Cervical Screening website where there is all the other relevant information. Now, one other final point is that over the last few years, the role of human papillomavirus, or HPV, has been recognised as being an issue that can cause cervical cancer. And our girls in school are being offered jabs in Year 8. Now, 90% of our girls will take up the offer of the immunisations to prevent them getting problems in the future, but that still leaves 10% who are choosing not to. They are offered 2 injections at the moment, both in Year 8, and if your daughter hasn't had her injections and she chose not to have them last year or the year before, then you can talk to the school nurse or to the GP about getting these injections done. And if you have had your injections already, please remember that a smear test is still important. So this is Cervical Cancer Week, or Cervical Cancer Screening Week, so please make your appointment or look at Joe's Trust to find more information to be reassured and understand why this is so important for you. Thank you very much.